3 things to know about breech babies. Breech is when the baby's butt is closer to the vagina than the head. There are 3 types of breech position. One is frank breech. That is when the hips are flexed and both knees are extended so the legs are straight and the feet are up by the head. There's also complete breech where both the hips and the knees are flexed like in a cannonball position, and then everything else is incomplete breech. Now, breech is pretty common early in pregnancy when the baby is smaller and there's a lot of room for the baby to move around in the amniotic fluid. About 25% of babies are breech before 28 weeks, but as the baby gets bigger and has less room to move around, only about 3 to 4% of babies are breech at term. Now, when a baby is breech, we can attempt something called external cephalic version, where the baby is turned from breech to head down while still inside your uterus. There are a few doctors, very few doctors, myself included, who will do a vaginal breech birth, but the most common thing that happens for a breech baby is a cesarean birth. Now, if you want to learn more about breech birth, like what are risk factors for breech birth? Do you have any of those risk factors? How can we tell if a baby is breech? Or some of the controversy surrounding why we do cesarean births for breech babies. Check out episode 153 of my podcast, all about pregnancy and birth. That's drnicolerankins.com/episode 153.